Sir, why did you choose pediatrics at Osmania College? Why not other government or private colleges? Sir, how about academics like classes, seminars, thesis, general clubs? Sir, how often do you get night duties? Sir, how will be the night duties? Are they really tough? For the pediatrics, you have wards here. PSR, NICU, PICU, SNC, RIC. Sir, how is the senior junior bonding? Sir, what are the super specialization scopes immediately posting? Sir, what are the future job opportunities immediately? Sir, what is the work-life balance in pediatrics? So guys, welcome to our YouTube channel, Osmania Docs. Are you planning to take residency at Osmania Medical College? Let me give you the real inside story regarding the residency at Osmania Medical College. Myself Dattatreya. Today I am with our beloved senior Dr. Vamshi sir, who is pursuing third year residency at Niloufer Hospital. Sir, when did you decide your dream branch as pediatrics, whether in the UG or in the internship or post NEET PG?
Actually, it was during my internship period.
Okay.
To be honest, my dream branch was actually general medicine,
Okay.
and as such, I didn't get such a good rank to get general medicine at a really good college.
Okay.
Hence, I choose pediatrics was my second option, so I went for pediatrics. And during my internship days, my UG college had a good pediatrics department, so I had a good overview regarding the pediatrics as a branch. So I have decided pediatrics as my second option. Hence, I have chosen pediatrics.
Okay, sir. Sir, why did you choose pediatrics at Osmania College? Why not other government or private colleges?
Actually, it is a Apex Institute of Telangana, combined Telangana and AP state.
Yes.
And there is no other institute in combined states which is as big and has this much caseload. I think we have the highest caseload in entire India according to statistics. The caseload, the exposure which we get at Niloufer Hospital is very good compared to other places. So, as such, I have chosen Niloufer.
Yes, sir. Sir, how many PG seats are there in the Niloufer?
Uh, Actually, currently there are 60 PG seats.
Okay, sir.
Yeah, and out of that, 4 are service PGs, and rest 56 come from the merit.
All other categories.
All other categories.
And general.
General categories.
Okay, sir. Sir, what about fee details and stipend details?
As such, there is no course fees.
Okay.
I remember paying only some 25,000 during the counseling. After that, there is no fee payment as such. And coming to the stipend, first year it's like now they have increased. The stipend has increased recently since the past 3 months. We are getting the increased amount. In the first year, it is 62,000 excluding taxes. In the second year, it's 68,000, and third year it comes to around 70,000. So roughly averaging, you will get around 65K per month.
Okay, sir. Sir, will the salary be credited at regular time?
No, actually, salary is not getting credited regularly. Like basically, compared to before, now it's okay. We are getting it every monthly or every 45 days like that.
Okay.
Yeah, but there is some attendance issue. Except that it's okay. At least you'll get every 2 months. Definitely every 2 months you'll get the stipend. Not every, even if not every monthly, at least every 2 monthly you will get it. Definitely. Right now it is like that.
Yes, sir. Sir, how about academics like classes, seminars, thesis, general clubs?
As such, academics, like there are daily academics from 2 o'clock to 4 o'clock in the afternoon. And among that, we have a roster actually. And in that roster, there are different academic programs.
Okay.
There are seminars where actually we get to, like, there is a roster, like there are all the entire PGs are divided in that roster. Like there will be third year, second years, first years for every academic activity. Like we PGs are divided, and there are seminars. Seminars basically you'll be given, you can choose a topic and give a presentation on that, like can be maybe diabetes or dilated cardiomyopathy. It can be any topic, and you have to present on that. Then there is journal club. Journal club is where you select an article, and there is that critical appraisal of that article, and then there is review article where you choose a recent article which is very good from a reputed journal, and you present that review article. Then there is mortality meet, where the entire month's mortality statistics are taken, and there is a specific case which is chosen, and we discuss on that the drawbacks, what happened, like
What mistakes?
what mistakes happened that led to the death of that case. And then there are clinical meets every week. Like every week there are two units. They present a long case and a short case, like which is a part of that unit. That like rare cases get presented.
Oh,
Those are the academic activities which happen, and as such, they are good actually. Okay, we can learn a lot from academics if we attend regularly.
sir, what about thesis?
Thesis, thesis as such, we get to choose our topic in the first year. We have a guide and a co-guide who get allotted, and the guide will be a professor usually, and the or professor or associate, and the co-guide will be an assistant professor.
Oh,
And you choose a set of topics, and generally they will select one, or if you are very much interested in that, you can choose the topic. And mostly clinical trials as such are not allowed. You generally have to go for cross sectional studies, or like if you have time you can do a case control study. And mostly only like to be honest, thesis is your personal interest. Like most of them will not guide you during your thesis. Like if you have any doubts you can ask them, and there will be like 6 monthly or annually thesis review where you present your thesis, like what is the progress of your thesis, how many cases have you collected. So there will be thesis review during which the professors give an appraisal about your thesis, like what are the mistakes in that and what can you do further and how to go about in your thesis. That will happen every like 6 monthly or 1 yearly, during which you get to know like if there are any drawbacks in your thesis, or like yeah, if you can do something better. It's like that.
sir, could you give about the overview of Niloufer Hospital and how department runs? What are the works of first year, second years, and third years?
Okay, sure. Actually, we are 60 PGs in each batch, so approximately to combined 3 batches will be 180 PGs.
180 piece.
And
SRs?
like SRs, there will be 12 to 15 SRs depending on the recruitment of that year.
Okay.
Then like second years, 15 of them will go for DRP. So excluding that, others will work at the hospital. Then department wise, there are around 5 professors right now, and 3 to 4 associates, and rest are assistants. Assistant professors are around 15 to 20, more than that, around 25 assistant professors are there. Then the work rota, like as such, the department is divided into 12 units.
Yes, sir, 12 years. Sir, recently professors are transferred. Previously, 12 professors are there.
Yeah, recently they have been transferred, and we do not know yet if there will be recruitment again into Niloufer Hospital. As such, now there are only 5 professors. And yeah, so even first 5 units only have professors.
Okay.
After that, there will be associates and assistants, and accordingly, like there are 12 units, and every day 1 unit admissions will happen. And as such, so you will get 1 admission every 2 weeks, and sometimes when you have a rotation Sunday, you will get that Sunday admission.
Okay.
Like that rotation Sunday will be approximately once in every 3 months, because like every month has 4 Sundays, right? Each Sunday will be divided like 1, 2, 3, 4, and along that it will go on. Like every 2 weekly there will be 1 admission. And as such, these are in the units, and there is emergency stations are separate. Like in emergency, there are one respiratory ICU separate, and there is one RICU, and there is one separate PICU, and there is separate one ESR treatment room where mostly there are all ventilated and encephalitis cases, like those which are morbid.
Yes, sir.
They will be in ESR treatment room. Then there is ESR step down where blood transfusions and like cases which are stabilized get from the treatment room or from other stations get shifted there. Then there are ESR wards. Like ESR wards are like we shift like those cases which are not stable from the units into the ESR wards. Then there is separate NICU. NICU, there are 2 levels actually, level 2 and level 3.
Okay.
And level 3 mostly will be taken care by the DMs, super specialty neonatologists. And level 3 we get only postings during the 3rd year. Rest all during the first and second year will be mostly posted in level 2 NICU.
Okay.
And level 2 is divided into inborn and outborn. In outborn, like all cases which get referred from outside generally come to outborn. Then which are delivered at Niloufer will be there in inborn. So yeah, every 2 monthly we'll have rotations like unit rotations and yeah, emergency rotations. Like if we do 2 months units, next we'll go to emergencies. Again we'll come back to units. After that we'll go to NICU.
Okay.
So we rotate units every 2 months, and there won't be any repetition of units as such. So once you do a unit, you're done with it.
Okay.
Yeah, this is what happens. And
Sir, how often do you get night duties?
night duties as such. During the first year, approximately we'll get 8 to 9 duties
Per month.
Per month. Then during the second year, it will be 7 to 8 duties per month.
Okay.
And during the third year, you will get 5 to 6 duties per
5 to
month.
6 duties.
That is constant. And few stations you will not be doing in your second year. Then again, few stations you will not be doing in the third year.
Okay.
Few stations are exclusively managed by first years, like ESR wards and step down mostly will be managed by first years. Then second years they'll be looking after and
They'll be guiding the first
then
years.
they'll be guiding the first years. And second years as such, duty stations, there are actually many duty stations. Like you'll have an EOP, emergency OP,
Yes,
where
sir, emergency.
during the night all the emergency cases they'll come first to EOP, and
EOP.
from there triage will be done. Then there is a ESR step down where the blood transfusions and the minimally like stable cases which need less monitoring will be present there. Then there is ESR treatment room where there will be predominantly ventilated cases and dengue shock syndrome. As such, those cases in shock, those cases requiring ventilation will be there in ESR treatment room. Then there is ESR wards where mostly cases like cases like which are not so stable and not like they cannot stay in ward and they require some level of monitoring. They cannot be entirely kept in general ward. Those cases will be there in ESR wards. Then there is PICU.
Yes.
There are many stations actually. Then you have an NICU duty separately. These are the duty stations, and per day approximately 15 first year PGs will be on duty. Then 10 to 12 second year PGs will be on duty, and 7 to 8 third year PGs will be on duty. So as such, you will be getting so and so 8, 7 and 6 duties approximately across all 3 years respectively.
Okay.
Then yeah.
Sir, how will be the night duties? Are they really tough or hectic or
Actually,
toxic?
they are kind of hectic. There'll be patient inflow continuously. The hospital is very big. It's a very huge tertiary care center. You'll get referrals from the entire state.
Yes, sir.
From both states combined. It's a very big pediatric hospital, approximately
Even from other
1600
states?
bedded hospital. We'll get referrals even from other states like
Yes,
Maharashtra borders and Karnataka borders, then Telangana, AP, like combined, like from many other hospitals. All the cases which do not have a diagnosis or which are critical and cannot be managed at the referral centers, they get mostly referred to Niloufer Hospital. And as such, per day you'll have a lot of OP. Like combined in 24 hours, the OP lasts approximately like 300 to 400 OP, like 300, not even 300 to 400. It will hit around 700 to 800 OP per day. And admissions during the seasons, it will be 120 to 130, 100 to 120 admissions approximately. And during the non-seasons, like it will be around 50 to 60 admissions per day.
Okay, so admissions are based on the seasons.
Based on the
During
season,
winter,
and yeah, during the winter, there'll be during the rainy season there'll be peaking of dengue, the
yes,
viral
sir.
fevers, and there'll be during the winters there'll be peaking of pneumonias.
Yes.
So season lasts approximately starting from July to December. These 4 to 5 months, the hospital will be very busy actually, and the work is actually hectic comparatively. Like during your duty hours, you'll be continuously monitoring, doing rounds, taking care of patients, and you have to do some additional works like difficult cannulations, intubations. As such, sometimes you get to place central lines also if they like If it's a chronic case which is there since 20 to 30 days, you do not get a cannula, or if it's a morbid case such that you require daily sample withdrawal, you have to put central lines. Yeah. And so you'll be continuously on work during the duties, and as such you get to sleep at night, like approximately during the first year you'll get 4 to 5 hours of sleep.
Okay, that's a nice thing.
Even during the second year also, like you can get 4 to 5 hours of sleep approximately, even both during the first and third years. During the third year you can, that will extend something like around 5 hours.
Okay.
5 to 6 hours. As such, you not like, it's not like you're continuously working through the night. You get to sleep for some time. Basically, there will be 2 or 3 PGs on duty, so you can take shifts at night,
Okay.
and you'll get time for evening snacks and even dinner.
1 hour for
1 hour
snacks break.
and 1 hour for dinner. As such.
That's actually great thing, sir. Many
Hospitals, actually, many hospitals do not have it.
yes, sir.
It's kind of a advantage over here.
Yes, sir.
You have some leisure time at night.
Sir, enable pediatrics will have wards, ESR, NICU, PICU, SNCU,
SNCU, yeah.
RICU.
RICU.
Yes.
Night duties we do not get night duties in units actually.
Okay.
So all cases which are not so stable from the units during the nights after 2 o'clock. The general duty shift is from 9 to 2. Like every day, it's from 9 to 2. The morning hours, your morning duty will last from 9 to 2. Then 2 to 4 you'll have classes.
Okay.
At 4 you'll get relieved. Sometimes if the unit is very busy, you have to come back after the class and work till 5 o'clock around like that. Yeah, mostly.
If you
or
have
else
lot of admissions,
lot of admissions, or during the, like if post admission day or post admission 2 to 3 days when the ward is very busy, you have to put in 1 hour or 1 odd hour or more, or else mostly you will get done by 4, including your classes.
sir, how is the senior junior bonding?
As such, nobody like you, that work culture is very fine. There is not much toxicity actually.
Okay.
Like most of the seniors will try to teach you, and you'll get to learn a lot from your seniors.
Yes.
And as such, Osmania is like that. As far as I know, there is not much toxicity in any department at Osmania. Even pediatrics is like that. So for us, the senior junior bond is actually very nice. We go out sometimes for lunch as such. Yeah. You'll make friends, bonds with your seniors, and along with that, mostly it will be teaching activities. Nobody scolds you for anything, or it's like so much toxic culture is not there. And the working hours are same approximately for them and you. You won't be as such like the senior will leave the entire work on juniors. In most of the stations, it won't be possible like that actually.
Yes.
Because the hospital is very busy, and you have to be working mostly during the entire 3 years. Like your number of duties will reduce, and the stations which you will be working will reduce. But as such, during the 3 years, you will have similar work. It's not like the amount of work drastically reduces as you go through the years. It won't reduce so much. As such, you'll be working similarly throughout the 3 years.
So you'll be working in the first year, second year, and
Third year, yeah, you'll be working
that,
continuously, and as such, that toxicity
work is
in that
also
hierarchy is not there.
Work is also equally
Work is
divided.
also almost equally divided, because yeah, there are many stations, and so even if there are 60 PGs, the PGs working in the duties will be very less per station.
Oh.
So you have to work throughout 3 years. It's like that.
Sir, what are the super specialization scopes immediately post PG?
Post PG, there are. Now it's a very evolving branch. As such, the super specialties are evolving in the past 5 years.
Okay.
Before, there are very few pediatricians actually who did super specialties, and even if they did, mostly like neonatology was had a very large number of people went into neonatology.
Okay.
And now, as such, DM options are many. You can go for neonatology. There is pediatric nephrology, oncology, gastroenterology, cardiology. There are actually very few seats. In combined India, you'll be around very less seats. There are many neonatology seats as such. Other departments, the seats are very few. You need to get a very good rank if you want to, if you want other departments as such, and as such. And one of the very good advantage is that if you are not getting medicine, you can go into adult branches from pediatrics
Yes.
if you have interest. You cannot do gastroenterology. Except gastroenterology, you can do all other branches.
Okay.
You have to prepare separately for medicine, and you have to give the medicine essays. And as for pediatric branches, they are okay. There is DM neonatology, which has a very bright scope, and there are other branches which are budding right now. And as such, those branches you have to plan for settling in tier one cities itself.
Tier
They
one
are very budding right now. And yeah.
Sir, what are the future job opportunities immediately post
Future
PG?
job opportunities.
Tier 1, Tier
Actually,
2 and Tier 3 cities.
yeah, okay. Now, coming to tier 1 cities, as such, I can speak about Hyderabad for now. Hyderabad is mostly saturated. Then, after SRship, you can work at registrars in corporate hospitals.
Okay.
You get paid around 90,000 to 1 lakh per month, and yeah, you get night duties. You have to work under a consultant. It's mostly. Then that is what you can do, or else you can join as such. Peripheries are not so saturated. Even now, there are many opportunities in tier 2 and tier 3 cities.
Okay.
You can go as you can put an OP based practice, and yeah, OP based practice is really good. There is scope for OP based practice. Then there is you can work. You can put your own setup like 10 to 20 bedded setup, and you can run it like that. Then even in peripheries, you can work in hospitals if you want to. Yeah, tier 2, tier 3 cities, there are very huge scope. Like there are doctors who are earning approximately even 3 to 4 lakhs per month after doing pediatrics. As such, peripheries are not saturated yet. You can still earn good amount of money. Then
In government setup,
government sector, you have job opportunities. As such, the big hospitals are mostly full right now. You don't have any vacancies. But now there are many medical colleges in the state.
yes,
You
sir.
can join as assistant professor also in other colleges. If you are willing to go settle afar from the city, you have opportunities in the government sector also. Then other things are fellowships. Like
Fellowships.
pediatrics offers lot of fellowships. There are IAP recognized fellowships where you have to do a thesis even during your fellowships. IAP, you have fellowship exam. IAP, Indian Academy of Pediatrics recognized 2-year fellowships are available right now across all branches. You can do DM neonatology, critical care.
Okay.
Actually, pediatric critical care is like now really in boom. Like you can take critical care. If you are like it's hectic. You have to put in more hours, but it's a very coming up branch, and it's a lot. It has a lot of scope. Like corporates, many people are looking for pediatric critical care specialists as such.
Okay.
So you can go into critical care. There's critical care DM available. Even fellowships are available at big corporates like Rainbow, Kims.
Okay.
Even in other states, there are many fellowship opportunities available in critical care if one is interested. Then there is neonatology. Neonatology, there are fellowships as well as DMs. Then, as such, if you do a fellowship, the opportunities of you landing a job or your salary prospects increase greatly if you do a fellowship. Like if you have a neonatology fellowship, your practice will be better. Even if you have a practice, it will be better. And even if you work as a consultant or so, your salary will increase. And yeah, so it's not like you have to definitely do DM.
Okay.
It's not like that. You can get on with a fellowship.
Okay.
Yeah.
In case of medicine,
Medicine
we must
mostly
do
now
super specialization.
super
otherwise,
specialty is a must.
Yes, sir.
It is not so in a pediatrics. As such, pediatrics is still as far it's an end branch for now. You
In
can
future,
in future
it might require
super specialty. Now also, if you want to settle in tier 1 cities, you might have to do super specialty.
Okay.
In tier 2, tier 3 cities, there is
General
as
pediatrician is
such general
enough.
pediatrician will be good enough for. As a general pediatrician, you can earn good amount.
Sir, what is the work-life balance in pediatrics if we choose as a dream branch?
Work-life balance, as such, duty hours will be hectic. You can like if you have some hobbies, you can get 1 or 2 hours time per day to have. You can go out during weekends. As such, you'll have 2 to 3 weekends off per month. You can go out during weekends. As such, during the PG, your work-life balance will actually be disturbed. As such, it's a very busy.
Even in any branch, it will be like that.
Even in any branch, it is like that. My branch also. Okay, you can. Except those night duties days, other days you will be free. Like nobody will disturb you. Like you won't get calls in the evening. As far as in Niloufer, evening calls, night calls, those all won't be there. And everything once the PG on night duty will take care. Once you give handover and go out of the hospital, nobody will be disturbing you.
Okay.
And as such, during the first year, it will be very hectic. You won't have so much time for your hobbies and your life going out. As such, during the first year, you won't have so much time. During the second and third year, so you'll have good amount of time actually. You can go out for parties. You can actually spend time with your friends. You can go out with your family. And work-life balance, if you have some hobbies like going to gym, playing sports, you can actually do it after 4 o'clock. Nobody disturbs you after 4.
Okay, that's a great thing.
That is one thing which is there. Like after 4, you won't get any calls.
Okay.
So mostly you are free. You can do whatever you want. If you want to study, you can study. Or if you have any other hobbies, you can pursue them after 4. Except on the night duty days, other days you are like mostly off. Nobody disturbs you. It's like that.
Sir, one piece of advice would you like to give to the young NEET PG aspirants who are thinking to choose this pediatrics as a branch?
Piece of advice I would say is you need to have a lot of patience as a
As we are
pediatrician.
dealing with kids.
We'll be dealing with kids, and and there is a lot of counseling which happens. You have to counsel the parent. You are dealing with both actually. You should deal with that. You should deal the trauma of both the child and the parent. So there will be a lot of counseling aspect which happens. More than the treatment part, the counseling part will be very important. And as such, the illnesses they tend to be prolonged in children. So you have to bear with the parent. And even during procedures, you have to be very sensitive. Like even for a child, even putting cannula is very difficult.
Yes, sir, it is very difficult.
Very difficult.
Even in my
And
internship,
all procedures as such, they are not very easy in a child. So you need to have a lot of patience. Sometimes hours and hours get through during putting cannulas, taking samples, because you need to be very patient with the child.
yes,
And
child will be
that
always
is
crying.
one actually, you have to be very sensitive as a pediatrician. Then other thing is, as such, I would say that if you have an interest in the branch, it's a very good branch. You have still there is scope in India because it is a growing population. Children.
Yes, it's a vagrant branch.
It's never like there'll definitely be children for you to treat. It's not like the branch is getting saturated in near time. Mostly it won't be saturated. And so if you have good interest and if you want and as such it is said that the pediatricians are the happiest doctors. So yeah, if you want to be happy, treat a child, and if you're personally interested in taking care of a child, you can choose the branch.
Thank you, sir, for sharing your valuable time
Thank you,
and giving your
Nathan,
insights
for
for younger.
inviting me.
Okay, sir. Please do like, share, and subscribe for more content related to NEET PG and residency at Osmania Medical College. Stay tuned. Signing off.